cells infected by MFE recapitulate the progression of this tumor. You see neuroblasts here, normal control, not infected, flat mesenchymal cells. Upon infection, they become highly malignant and transformed. They start growing on top of each other in a very disorganized fashion. And these cultures also, as you can see, have a tremendous growth capability. The transformed cells behave like aggressive tumors from children, like the cell line SKNDE shown here. So they become indistinguishable. And also, if you study the genome of these cells, you discover that it's completely deranged now. Compared to control genomes where NMIC is deployed, SKNX cells have amplified the oncogene NMIC at least 100 times. SKNSH is an intermediate amplification about 10 times. But also in animal models, it is consistent in rats. We can show the presence of an aggressive disease characterized by abdominal tumors, and also in mice, in these mice, we can show the outgrowth of large masses from the cells infected and transformed by MFV, SK, and SH in the contralateral flank control cells were injected. So going back to the model of Desiderio I showed you before, most likely this impinges on infection and transformation of a target stem cell which reacts differently upon this infection. So some cells will affect the mitotic apparatus, mitotic spindle, thus becoming triploid, aneuploid, and in fact these are the cells and the tumors with better prognosis. We know that this family of viruses attacks the mitotic, the spindle apparatus. Other cells, however, will start fragmenting the chromosomes and their DNA, thus creating different rearrangements and copy number variations in amplification. And I checked very carefully the time, so I don't want to overdo it. And so I will show you in the last 2 minutes, maybe even less, like Dr. Malman before, this will be presented, not just the past. I'll show you something from the old work by Prof.Dr. and the present, but the future. So also for us, the future means genomic approaches. And here you see some of the possibilities already attempted in the field of pediatric cancer of neuroblastoma. This is just evaluation of CNG, copy number variation. And you see this technology is extremely sensitive and powerful, and already pick up aberrations on chromosome 2p24, which is exactly where the oncogene, the protoprotein NMIC is located, the one I show you. And for example, other alterations on chromosome 1p, where you have deletions, so most likely the presence of a tumor suppressor gene. But look what this technology has shown us very recently. On 2p24, there is another locus which is amplified, and that corresponds to another gene, which is called anaplastic lymphoma kinase. So it's a new gene involved in neuroblastoma, also known also from non-small cell lung carcinomas. But this provides already a clue, a hint that maybe we will reach, again, with personalized medicine, we will reach a therapeutical approach. Although, unfortunately, these variations in ALK are present in only about 1% of neuroblastoma cases, in familiar cases. But since a few months ago, I started an interesting collaboration with the Max Planck Institute in Berlin, particularly with Hans Lercher and Michael Schweiger of the Genetic Institute and Vertebral Genomics. And with them, we want to analyze not only pediatric tumors, but also some adult solid cancer. Here you see in the last slide, I review approximately more than 12 human cancers for all the studies which have been published so far, employed next generation sequencing or high throughput sequencing approaches, so-called GGA, global genome approaches. What is the general picture, which is, and with this I conclude, which is coming out today? It's quite different, strikingly different from the classical models that I showed you at the beginning. First of all, the number of mutations that we find in human cancer is quite higher than what we expected before. Remember 101, but about 6 different mutations, 6 different families. Well, now we are about between 10 and 20 different mutations in the majority of tumors, aggressive tumors such as pancreas or lung cancer. Other interesting point is that if you consider one particular mutation, they can be divided in 2 types at least. One type is called mountains, another type is called hills by Vogelskin. Similar names have been adopted by Michael Stratton. He calls them drivers and passengers, although not equivalent. What does it mean? It means that in each tumor you will have a cocktail, an association of different genes which are deranged. It's not always the same gene, unfortunately. So this makes a therapeutic intervention much more difficult if you think about it. And the final point is that, unfortunately, the arrangements which we have seen, which we have studied, also this ARF, as I mentioned, are quite infrequent. So you find them only, for example, in 5% of cases. Again, this will make strategic approaches, therapeutic approaches more difficult. Thank you very much.